All right, in this section, we're going to talk specifically about the biological side of this equation. So these three pieces of the model, this is going to focus on the biological side of this. And we're going to talk primarily about the pharmaceuticals and how medications can treat different disorders, and then also talk a little bit about some alternative methods as well. So first, I want to go over a bit of the history of psychopharmacotherapy, which is basically the idea of how different medications or the biological side of things showed improvement or treatments for different psychological disorders. And some of these are really interesting, and you can see kind of how we started learning about how the biology or how the medical side of things can interact with our psychology throughout some of these historical landmarks that we're going to talk about. So the first one was in the early 1800s, and this one was really interesting. And so what doctors discovered is that fever from malaria was actually seen as a potential treatment for different psychological disorders. So specifically, when patients contracted syphilis, they had sort of these psychological symptoms of this as well, where it would cause different distorted thinkings and hallucinations. And when patients contracted malaria, they produced an intense fever that actually subsided some of these symptoms. And so it was kind of a really interesting interaction where the fever from malaria was enough to sort of subdue some of these psychological symptoms that were coming from syphilis. So even though these all kind of sound bad, there was some good that was kind of taken from this, at least in learning that maybe there was some interaction here that could be used to help treat some of these psychological symptoms. Then in the late 1920s, we actually saw sort of a similar interaction where some different treatments through insulin shock therapy was actually shown to reduce some of the psychological symptoms of schizophrenia. And so again, we see sort of this intense sort of biological reaction to something that is going to reduce some of those psychological symptoms. Again, maybe not what they expected, but an interesting interaction that kind of alluded to maybe there was something going on here that they could try to study farther and use in a more efficient way. Also in the 1920s, we saw that electroconvulsive shock therapy was seen to reduce different psychological symptoms from different disorders. Again, this one was really interesting because, again, it's almost like causing some negative harm to the body, but in turn produces some positive effect. And so I find these really fascinating to look at. And electroconvulsive therapy, while primarily not used anymore, has still been shown to have some level of efficacy on some severe psychological situations or some severe psychological cases. It's almost like you can think about it as almost like electrically resetting your brain, and it tries to kind of reduce some of those really severe symptoms. Again, it's not used very commonly, but there are some rare cases where it might still be considered as a treatment even today. And then finally, in the 1950s, the first antipsychotic drug was discovered, and that was utilized to again treat different psychological disorders from a controlled medical standpoint. And so as you can see, we kind of discovered this through, in some sense, trial and error, and seeing how maybe something negative actually maybe had some positive outcome on some psychological condition that was going on. And so I just, again, find this really fascinating to see how we went from just trying or finding out random interactions to having some more scientifically discovered and controlled medications for specific psychological disorders. And so next, we're going to look at a few of these and kind of just talk about a little bit about how each of them work and what they focus on treating within the body. So the first one is looking at different antipsychotic drugs for schizophrenia specifically, and they kind of fall into two categories. There's the typical antipsychotics, which primarily focus on blocking dopamine receptors within the brain, and you can see a couple of those listed here. And then we have the atypical antipsychotics, which focus on blocking both dopamine and serotonin receptors within the brain. And so you can see these are a little bit newer, and these are ones that focus on a couple different aspects to try and look at this from a multi-standpoint and actually work to block multiple different neurotransmitters that might be affecting different parts of this disorder. Next, we can look at medications that are meant to treat different depressive disorders, also known as antidepressants. These medications primarily treat serotonin, norepinephrine, and dopamine within the brain. Specifically, we can see different types of these like MAOIs, SSRIs. These are two of the most common ones that you might have heard of before, but these all act in different ways, again, to focus on specific neurotransmitters and regions of the brain to alleviate symptoms of depression, and specifically doing that through blocking or affecting the balance of things like serotonin, norepinephrine, and dopamine. Then we have anxiolytics for anxiety disorders, and these are medications, again, that are primarily made to affect and work on the GABA system within the body. And GABA is primarily a suppressive type of neurotransmitter which reduces activity within the brain. And so a lot of the times anxiety deals with having not enough GABA, and so the brain is at an excited or higher than normal activity level. And so these medications act to work to either increase natural GABA or maybe mimic GABA in certain ways to try and settle down the psychological symptoms. These can include things like barbiturates or benzodiazepines, both of which, again, act to try and settle and calm the nervous system as a whole. Then we have mood stabilizing medications specifically made for bipolar disorder. And what these do is they typically try to limit both the highs and the lows. So they try and bring more of a balance and kind of, again, stabilize the mood to more of a neutral point within the body. These primarily work on the serotonin system. One of the most common ones is lithium, which again acts to balance out spikes, both high and low, of serotonin levels to keep things at a more stable or constant or consistent level. We might also see some that work on that GABA system again as well to try and again sort of balance out the system and keep things not too high or not too low within different regions of the brain. Now, those were just a few of the different medications that can be used for different psychological disorders, but there are other methods that we can look at here as well that are aimed at treating psychological disorders, but not from a pharmaceutical standpoint, but instead from another way of maybe physically manipulating the brain. And so this is a really cool technique that's been done to affect activity levels within the brain. This is called transcranial magnetic stimulation, or TMS. And what this is basically an actual handheld wand that has a strong magnet at the end of it. And this magnet can be focused and controlled in a way to actually affect signals within different regions of the brain. And so it can be used to either excite regions of the brain when it's physically moved over that part of the skull, or maybe inhibit different regions as well. And so over time, this can be used in sessions to train parts of the brain to either have increased activity level or decreased activity level. And so I think this is just a really cool method that actually, again, can use some device or some tool completely outside of the body. It's not sort of invasive in any way, but it can still have these internal effects that change the way the brain is behaving. Again, some other methods that are not pharmaceutical, but still look at the biological side of this equation are things like electroconvulsive therapy, like we talked about before, TMS, which we just discussed. And then the third option is the most invasive, which would be things like psychosurgery, which might utilize deep brain stimulation or actually implanting different things that can stimulate regions of the brain deep inside of lower levels of the brain. So there might be electrodes that are placed that can excite different regions within the brain and actually change the activity level through a physical manipulation deep within the tissue. As you can see, each of these have different pros and cons, maybe to how well they work and also to how invasive or dangerous they might be. So these are, I'd say, less common than the pharmaceutical side of things, though a really interesting kind of approach to take and a way to look at how we can maybe physically affect the biology of the brain without introducing chemicals as the solution in this case.